Hi everybody, Patrick Lerouge here from Evolve Restorative Therapy. You can find us at livepainfreeprocess.com. Alright, so today I'm going to try to bust out 3 things in one talk. So, these 3 things I'm going to talk about is plantar fasciitis, heel pain, Achilles tendonitis. All 3 with a big looming thing of, if it's chronic, there's something else driving it. We want to start realizing that plantar fasciitis is an inflamed tendon sheath called your fascia that surrounds your foot. That is your plantar fasciitis. It gets picked on a lot, and a lot of people like to mess with it a lot. What you have to realize, it's inflamed for a reason. The reason is the intrinsic muscles of your foot does not work properly. When it doesn't work, now the arch that you have doesn't act as the shock absorber, so now your fascia does. So it just gets harder and harder and harder, and that flattens out your foot, and then you're just landing on something hard, which then locks up your ankle, makes your calf do all the work. So we have to get your intrinsic muscles of your feet to start working then. You can do that easily by rolling a ball on your foot. Start stretching your foot, getting it to start learning how to move, getting it to learn how to do this again. And then you can look up Dr. Emily. She's from Evidence-Based Fitness Academy. You can find her on Facebook. She's the queen of feet. She knows everything. So if you want to know everything that you need to know, if you have a specific problem, look up that woman. She is dope. 2, she taught me a lovely trick called short foot. Short foot gets you to learn how to bring up your arch, bring in this, gets the intrinsic muscle of your foot to actually start exercising and working. That's how you clean up plantar fasciitis in its first step. Second, heel pain. Heel pain is this and Achilles tendonitis meshed up in one. So at the heel here, you can see the intrinsic muscles kicking in place, as well as the next big thing that you have to worry about is your gastroc, which is your calf, as well as your soleus, which is a muscle underneath your calf. Let's show you that. Soleus, calf, gastroc here. Soleus is the next thing that we have to worry about. Soleus is right underneath the calf. It lies deep, and it has a lot of functions. One of them that a lot of people don't realize is it acts as like a second heart. Every time you take a step, if this is functional, it actually squeezes blood out from your lower limbs up into your abdomen, so you can actually start to gain circulation. So people that feel like their feet are always heavy, it's that bad boy that's not working properly, that's not getting the blood up and getting you moving. Okay, so this and your calf, your soleus and your gastroc wraps and intertwines with each other. They interweave to form your Achilles. So if you have Achilles tendonitis, it's those 2 bad boys that's not working properly, and it's probably because you're locking up the ankle, probably because your intrinsic muscles of your feet aren't working. So that's why you can clump all 3 of these issues in one. Get your intrinsic muscles of your feet working, stops the heel pain as well as the Achilles tendonitis. Because we're getting everything to start working, because the arch now becomes a stable object and it starts to absorb weight, which allows your ankle to be a movable object, which then your calf no longer has to try to stabilize everything by locking in place. Those 3 things are key. So what you have to do is realize all 3 of those things are going on. If you have one or 3 of those issues, and then 2, if it's chronic. This is the hard one to deal with. If it's chronic, it's because your body and something on the internal level is saying, I have to run from something. So let's take an easy example. I love my moms. I work with a lot of them, and they don't realize that they have plantar fasciitis, Achilles pain, all these different things because they're always on the run. They're running. I see this with a lot of people that are always on the go. When you intend to go, what happens is your body intensively tries to reach out in front of you to go grab something, to go. And what happens is, if you do that and you stay steady, you're gonna land right on your heel. For runners, that's horrible because that's your brake. You're never gonna gain speed if you're always braking yourself. 2, back to the point of impact, which is gonna be exactly on that heel, which locks up the ankle, gets the calf to start tightening up with the soleus, and downward spiral we go. So you have to realize with chronic pain, there's always something that's gonna get you on the run. Whether it be emotional, mental, I always have to go, or mental being your boss saying, you have to do this for me, you have to do this for me, you have to do this for me, and you have to go, and you have to be always moving. That is a recipe for disaster for your feet if you don't take care of it. So you have to start recognizing there's a muscular aspect, a mental and a physical aspect, and an emotional aspect to chronic pain, which leads to soleus tightness, calf tightness, intrinsic muscles falling apart, plantar fasciitis, all leading down to 3 lovely things: plantar fasciitis, heel pain, Achilles tendonitis. So if you want some more information on what we need to do to clean all that up, stretching is always a key component, trigger point work key component, fascial release, massage therapy, any therapy actually can work. It just depends on where you stand while you do it. So remember, you can live, move pain-free if you try. So if you like this, please, I beg you, send it out to the world. Everybody needs to know how to clear up these things because so many people haven't. 2, this is something I haven't been saying a lot, but I have a free offer for everyone. Go to my website. You can get some stretches that you can utilize every day. You can get some articles that explains more about restorative therapy and how you can live and move pain-free. You can do anything that you want just from that free button. So what I can do is teach you how to live and move pain-free through a free offer. Please go to my website to receive it, as well as pass this along to the world because everyone can help and everyone needs help. And if I can help them, I think. All right, so I'll see you soon. Bye.